Hello, dear students. So today we will talk about stressor-related disorders. So the objectives of this presentation is we'll relate the characteristics of stressor-related disorders. We will identify the patient-centered nursing interventions for patients with stress-related disorders. And we will also identify patient teaching and training techniques to manage stress-related disorders. Now, what are stress-related disorders? These are the disorders that can actually develop after a trauma or stress-related event. Many times they are interpersonal violent episodes, or sometimes it could be a military combat. It has to be very excessively threatful event that can cause stress-related disorders. And it is very important for nurses to have a proper understanding of how to effectively monitor and care for the patients experiencing this type of disorder. So one type of stress-related disorder is acute stress disorder. And what happens in this disorder, that the term acute means that it's short term. It happens right away following the disorder, and then it could last from 3 days to maximum up to a month. If it lasts more than a month, then it's not considered acute stress disorder. So exposure to traumatic events, they may cause anxiety and detachment and other manifestations about the event. What happens that patients even might have a little bit amnesia, and then they may have dissociative manifestations regarding of the event. And when I say dissociative manifestations, it means that they kind of separate themselves from that event. They don't see themselves as an event, and then they would feel like that everything that happened was unreal or it was like a dream. So I don't know if you have ever felt that way, or you've met somebody who said, I can't even believe it happened to me, or if something very traumatic happened to someone and they don't even remember happening it to them. Or they may have vivid recollection of it, but they may consider it a dream. So that's actually the result of acute stress disorder. Post-traumatic stress disorder, on the other hand, it's in response to a situation involving an actual death or threat of a severe injury. And just like I said earlier, that stress-related disorders are as a result of something like military combat. We see a lot of we see it among militants or military personnel going through these disorders. So there is intense feeling of fear or dread, and there are recurring episodes of the events that they have gone through, those stressful events. And the symptoms and signs, they can last more than a month, several years, sometimes even for a lifetime. And there is a sense of anxiety constantly that was not previously present. That feeling was not present, but it's also accompanied by extreme guilt. And sometimes patients go through some emotional numbing. They have sleep disturbances, insomnia, sometimes avoidance. They do not like to be among people, or they avoid social gatherings and places, certain places that would actually invoke those memories. They are unable to concentrate, and their social or work functioning is very impaired. And then again, in those disorders, patients go through dissociation and depersonalization. And now when you'll ask me, Ms. Khan, what is dissociation and depersonalization? And I'll explain it to you now. There are dissociative disorders. Now, one part of dissociative disorder is where it's depersonalization and derealization. I should probably. So, did you see how it's like the brain kind of is split? It's one brain, but it's split in two. So, what happens in depersonalization? There is a feeling that somebody is watching this patient from outside. The patient might feel that somebody is watching him from outside and it's actually them. And they do not connect their mind with their body. And then derealization is a feeling that outside events are unreal and they're actually living in a dream. And the dream may have objects or things happening which may be smaller or larger than their actual size. So dissociative identity disorder is where a patient displays more than one distinct personality. And what happens, some kind of stressful event would happen which would precipitate switching from one reality to another. And those realities are quite different from one another. There could be two or even sometimes more personalities. And I'm sure we all of you may have watched quite a few movies on about them, but it's very difficult living with those disorders. There's another disorder which is called dissociative amnesia. So remember, in dissociation, patients are actually not associating themselves. Their mind and body is not associating. So what happens in dissociative amnesia, when a stressful event happens, patients, they tend to separate them from that event, and their memory blocks certain details of the event or the time or the place or information about the event because it's so traumatic. They have amnesia. And it could be just a certain period of time or just certain details, or it could be everything altogether. They may have complete amnesia about that event happening. So, how do we help those patients? And if you notice over here, I have patient centered nursing care. And I'm emphasizing on patient centered nursing care because remember, it's about patient. It's about patient's perception of the problems they are going through. It's about patient's perception or expectations, what they want when they are in your care, during their care, what their goals are, what their expectations are, what are their hopes to meet the optimal level of health. And in order for you to do that, we must establish a therapeutic relationship, and we have talked about therapeutic relationship in detail. We should encourage the patient to share their feelings. Another thing that can help them is to provide them a safe and routine and non-threatening environment. Because a lot of them, the events are triggered by something very traumatic or stressful. So providing them a therapeutic and safe environment can help minimizing those triggers. Monitor these patients for suicidal ideation because they're at high risk for suicidal ideation. And use multiple strategies like music therapy and relaxation, guided imagery, or breathing techniques to help them relax. There are certain therapeutic procedures, many of them we have already talked about. Um, I will just briefly go over them again. Cognitive behavioral therapy, where what therapists do, they kind of help patients change their perspective about the sequence of events and the distorted image that they have about that event. They try to change the perception of it, and they try to use the relaxation therapies and work on their negative thoughts. And that helps patients to minimize the triggers. There is another therapy which is prolonged exposure therapy. This therapy is very interesting actually. So what the therapist does, they use techniques of relaxation therapy, but in addition, they kind of expose the patient to similar kind of situation or that similar stressful event or trauma that triggered the stress related disorder. And it's done either by imagination or it's done by very controlled and safe environment through simulation. And those events are created, they're simulated. It could be pretty risky if you ask me, but many times it works because the therapist is there to help patient get through those events. And what happens through repeated exposure, the impact of that event is minimized and patient's response is lessened and lessened and lessened until they learn how to handle the the stress. There's also psychodynamic therapy, psychotherapy, where therapists would get in touch with the conscious and unconscious, and they would try to work on triggers that created the episodes of stress-related disorders. Patient education is very important. You tell patients to utilize relaxation techniques and other anxiety-reducing strategies. It's very important to tell patients to keep a journal of their triggers. What actually causes them to go through those episodes and why those episodes are recurrent? What actually puts them through those episodes? So tell them to keep a journal to identify emotions. When this happens, how they feel. Identifying those emotions can help them work through those emotions. Educate patients to avoid caffeine and alcohol, and tell patients to observe and experience physical objects sometimes when they're going through those episodes, like touch a piece of ice or take a shower. Those experiences and other stimuli can take their mind off and reduce the anxiety and stress and distract them. Also, promote adaptive coping strategies. We have talked about adaptive coping strategies in the past, so positive self-talk and reframing irrational thinking, reminding themselves that this will pass and I'm not in that event again, it's not happening. Assertiveness training and problem-solving skills. And then we teach him to work on their communication skills and relaxation techniques and meditation, support systems and practical attitude, sense of humor, and then also encourage him for self-care and diet, exercise, leisure, avoiding stress increasing substances, caffeine and alcohol, like I previously said. And last but not least, faith in spiritual power and in yourself. Remember, as nurses, we are providing holistic care. Again, remember, mind, body, and soul. So we have to take care of them all. So let's do a practice question real quick. A nurse is assisting with collecting an admission history for a patient who has acute stress disorder. Which of the following patient behaviors should the nurse expect? The patient remembers many details about the traumatic incident. The patient expresses heightened elation about what is happening. The patient remembers first noticing manifestations of the disorder 6 weeks after the traumatic incident of the event, and the patient expresses a sense of unreality about the traumatic incident. So we should rule out the first one because the patient actually does not remember any details or many details. They do not express heightened elation, and it happens right away. It's an acute stress disorder, and it lasts only up to a month. So the right answer is D. The patient who has ASD often expresses dissociative manifestation regarding the event, which includes a sense of unreality. So good job, students. You got through the presentations. Please feel free to reach out and we meet during our lecture. Let me know if there are any questions. Thank you.